everybody. Thank you so much for joining us. I'm Kristen Mason with Casey Women's Ministry, and I am so excited to be talking today with Dr. Lauren Hughes of Bloom Pediatrics. Thank you so much for joining me, Lauren.
I am so excited to be here.
Okay, so tell us a bit about Bloom Pediatrics. How did that come around, and what exactly do you do?
So I am a board certified pediatrician as well as an IBCLC or an internationally board certified lactation consultant. And I'm a pediatrician. So I do all the well baby care, the sick visits, but I also have incorporated the lactation side. So anytime someone is breastfeeding, I can assist with that. But my practice is really cool, and I just love what I do because I get to actually spend time with my families. My appointments are 1 to 2 hours. My patients can text me or call me whenever. They get 24/7 access. I go to everyone's home until their 1 month wellness check at least, and do all visits in home because I do not think a birthing parent should have to leave the house so soon after giving birth and shouldn't have to carry a car seat into a clinic and sit and wait with a screaming baby. And so I think that that first month especially, people are best supported at home. So I do all of that as an included part of my care. Whenever you do come to my clinic, I have 2 locations. So on Mondays, I am at a wellness collective in downtown Overland Park. And then Tuesday through Friday, I am at my Westwood location at 47th and Mission. And my patients, because I'm the only employee, they get all of my attention. And so there's not a waiting room there. You're not having to tell your story to a nurse first and then sit and wait for an hour. That just doesn't happen.
Wow, that's amazing. That's such a unique form of care and so incredibly personalized.
Yeah, it is. Yeah.
Awesome. We're so excited for your workshop. Breastfeeding is near and dear to us since we work with a lot of breastfeeding people. Can you tell us a little bit about how you came to have a passion for breastfeeding?
Yeah, I feel like a lot of professionals in this, it actually started with my first child. We struggled a lot with breastfeeding from the beginning, and we ended up having a tongue tie and got that revised, and then it took off. But during that struggle, I realized how hard it is to get help. And someone that is as connected as a physician, I assumed that it would be easy, and it wasn't. And so that's when I kind of learned more about the barriers that come with it. And then the other thing that was that I just started learning a lot just from other physicians who practice breastfeeding medicine, and learned just the intricacies and the wealth of knowledge that comes with breastfeeding medicine, and just the benefits that go with breast milk that I did not know existed. Until I started really diving deeper and finding the evidence behind it. And it was just fascinating. And it really kind of changed the trajectory of my career.
So can you tell me a little bit about the starting of the breastfeeding journey and how you kind of work with moms when they're first starting breastfeeding?
So it depends on where the baby's born. I usually start seeing kids at about 2 to 5 days. And it depends on, like I said, where they're born. If they've already started receiving help, those in the hospital usually see the lactation counselor whenever they're there, or if they're born at home or at the birth center, oftentimes they have a doula who starts with the breastfeeding immediately after birth. Mm-hmm. I also do offer a prenatal breastfeeding class to my members, and to anyone else, but
that's awesome. I did not know that. That's so great.
Yeah, so I do a prenatal breastfeeding class starting at 36 weeks, so I can help set expectations and prep them to know what is coming. And because evidence has shown that people who prepare while pregnant, they have more success breastfeeding than if they start their education at the time of delivery, because as any mother knows, you can't really think in the first couple of days postpartum.
Yeah, and those first 10 minutes to an hour studies show, that's an incredibly important time for establishing breastfeeding.
Yeah, so
Not that if you don't in that time that you can't, it's just studies show that it tends to be a bit easier.
Yes. And so I talk about how to advocate for yourself in terms of protecting that golden hour that we call it, preferably even up to 2 hours, but usually by about an hour and a half, most people are ready to kind of get clean.
Yeah.
Yeah, I talk about how to advocate for yourself and for that time to bond.
So who is this workshop geared towards?
So my workshop is geared towards anyone who is pregnant and planning on breastfeeding. So either the birthing parent or their partner, and how they can come and learn how to best be supported and how to set themselves up for success.
Awesome. So are you going to be having some techniques or talking about like what to expect in the early breastfeeding days?
Yes, all of that. So I will talk about there are ways to actually prepare during pregnancy. So I talk about those things. I talk about maybe some things people haven't thought about in terms of like going back to work and making sure those things are set up, how partners can be supportive, how doulas can be supportive. And then I talk about like, okay, the immediate postpartum in terms of what happens in the first couple hours, the first 24 hours, the second 24 hours, because it is all very different, and how that child comes into the world, because it's they don't come out just right away being awake and ready to go. It takes them a minute. So I talk about all